maternal fetal medicine specialist. I practice in the Fort Worth, Texas area. I have been with this group since 2012, so 8 years now. And I joined the group straight out of fellowship after I finished my training.
How did you get into medicine? Did a woman inspire you to enter the field?
I kind of had my own internal desire to be a doctor. My parents say that I wanted to be a doctor since I was 3 years old, so I kind of had this sense that that was what my goal and career dream would be, but I did have a lot of mentors along the way, and one of them specifically was my own pediatrician, and she was a woman, and I really looked up to her and wanted to kind of follow in her footsteps. So a lot of mentorship along the way and lots of women that helped guide me to where I am today.
What do you think it means to be a woman in healthcare today?
I think it's really important for us to, represent the women in society in such an important role for our neighbors and friends and family, and just to, represent women in all different areas of life, and healthcare is so important for everyone in the community. So it just, shows good representation of everybody, and that we represent everyone in the community.
What are some of the challenges of being a woman in your specialty?
Well, I kind of thought about this question. I think twofold. One is, of course, the kind of historic stereotypes that exist that, a lot of people still, or used to, not as much now, but used to just think of men as the physicians. And so just kind of breaking through those stereotypes and teaching everyone that anyone can be a doctor, and that the woman standing in front of you is your doctor. And, we are here to take equally good care of you as the men. And so just kind of breaking through those stereotypes, even still kind of working on that day to day, is just kind of an important goal that I think most women in healthcare do have. And then secondly, I think it's challenging to be a woman with a career in general, especially healthcare that's so demanding, but also that most of us have a second job of being a family member. A lot of us are moms and wives and caretakers of our elderly parents. So just having that second job, it does feel like I have two full-time jobs. I'm a doctor and a mom, and kind of balancing the two of them and just being able to do 100% of both of them, and giving myself 100% to both of those jobs throughout the day. So it's just kind of balancing work and life, and learning how to do that as a woman. It's challenging at times, but definitely gratifying.
What are some of the positives that come from being a woman in your specialty?
I think it's just, having a career and following your goals, and providing excellent health care for members of the community. In my case, I take care of high-risk pregnant women, and so I'm a woman taking care of women, and I love that. I love that I can relate to my patients, and vice versa, they relate to me. I love talking to them about my own pregnancy and kind of helping them through, just feeling like they're being cared for by somebody that understands. So I think it's very relatable, and it just, is meaningful to the patients to connect to their healthcare provider and feel like you have a relationship with them. And I think a woman taking care of a woman is one of the most important ways that I can do that.
What advice do you have for women who may be applying to medical school or entering the medical field for the first time?
I just, encourage everybody to follow their dreams. Don't let somebody tell you you can't do it. I had a lot of people tell me I couldn't do it, and I didn't listen to them. I was stubborn and said, well, you know what, I think I can. And I did. And I am, really grateful that I just continued to do what I wanted to do and followed my dreams instead of being told that I couldn't. So I definitely encourage young women, if they have that dream or that, little twinge of desire to go into medicine, to do it. Just try it, follow your dreams. You'll find your passion. And, that's what's most important is, being happy in what you're doing. And then all the other challenges seem a little bit easier if you have found, what interests you and what you're passionate about. It just makes it easier day to day to do what you're doing and facing those challenges.
How can women physicians best support fellow women physicians in the medical field?
I think it's just, women supporting women in general. I think that's just an everyday challenge, whether it's healthcare or not. But I think, women that have this common bond of healthcare, especially women physicians, we definitely should support each other. We've been through the ringer together. We all kind of understand what we've been through and how we got to where we are. And so I think just being supportive of each other is so important. And I'm super lucky to have a wonderful group of partners that are all supportive of each other. So I'm very lucky. I know that not everybody is as lucky, but you got to just try to find that group that supports you so that you feel like you're part of a work family when you go to work, and that just makes it so much easier and more gratifying every day.
Is there anything else you'd like to add or touch on that we may not have covered?
I love the idea of kind of supporting women and showing young women that it's possible to follow your dreams and do what you want to do. And becoming a doctor, it's challenging, but it's worth it if that's what's in your heart. I support someone who wants to follow that dream.